Hi, this is Ming Chu, the injury guru. I am a physical therapist here in New York City, and I specialize in soft tissue myofascial therapy. And today I want to talk about traditional physical therapy versus the Ming Method. Now, the Ming Method is the method that I had discovered or developed, and it's based on putting together a bunch of myofascial techniques and then adding some stuff of my own, and I call it the Ming Method. I was trying to emulate the great Bruce Lee, the martial artist from the 70s. I idolized him when I was a young boy, and Bruce would always say, adapt what's useful, discard what's not, and add what's uniquely your own to come up with a system that you can call whatever you want, and I call it the Ming Method. So let's talk about traditional physical therapy regarding, say, a very common injury that most people get, say lower back pain. It's been reported that 80% of all Americans at one point or another in their lifetimes will experience pretty severe lower back problems. And it translates to over $100 billion a year in lost wages and cost in terms of therapies and surgeries. So it's a very impactful injury. So I want to talk about using the Ming Method versus using traditional conventional physical therapy and seeing what the differences are. Now, traditional physical therapy, when I was a student, and I also have friends of mine that work in clinics and physical therapy clinics here in New York, and this would be a very typical type of therapy that they will do. Say a person is a 50-year-old patient, a male, he's a little bit overweight, 5'10", 200 pounds, drinks 2 or 3 beers every few nights. He doesn't exercise much. He's an office worker. He has a pretty severe lower back pain from level 5 to 7, say in his right side of his lower back. He does not have sciatica. So let's say that's the person that is being plagued by this lower back injury. Now, going to traditional physical therapy practice, what they would typically do is when this gentleman would go into the office, they would put him on a stationary bicycle, let him ride on the stationary bicycle for 10, 15 minutes. And then they would proceed to put a heating pad on his lower back for about 20 minutes. And then that would be followed by ultrasound, which is basically using sound energy, converting into heat energy by means of this coupling agent, which is a gel. So it's basically a form of deep heat, the ultrasound. And that's generally followed by electrical stimulation. That you can use a low volt galvanic stim or a high volt stim or something called a TENS unit. And that's usually followed by 5 to 10 minutes of massage, and then they proceed to stretch the person by having the patient pull 2 knees to the chest and stretch out the hamstring, and that's the entire treatment. And that would take about an hour to do. I propose an alternative way of doing this. I've been doing this for over 23 years, and the Ming Method is a little different. I would really investigate the person's hydration level to see if the person has enough water in them, if they have enough magnesium in them, because magnesium is a relaxing, if you will, mineral that allows your body to relax. So if you have tight muscles, they tend to relax a lot better with magnesium. That's a well-known fact. Adding magnesium helps you relax. And then I would analyze the areas of restriction. For example, let's say his pain was, like we said, it was on his right lower back. Typically, you would see a restriction in his hip. So I would do a very intensive set of myofascial releases to his psoas muscle on the left side, for example, the left gluteal muscle. And also there's an area called the dorsal sacral ligament, which is the lower part of the lower back, right near the sacrum. And I would do that, and I likely would do both sides to get symmetry, but I would focus on the side that's more restricted. And remember, I said it was on the left side, even though the patient has pain in the right side. The question is, how does a left-sided tight hip affect a right-sided back problem? Well, it just does, because the fascia is basically an all-encompassing tissue, and it pulls the whole entire system to the left side. So if you relieve the tension and break up the adhesions on the left side, it actually cures pain on the right side, if that makes any sense to you. I've been doing this for over 23 years, so I've seen this happen multiple times. So I say this with great confidence. So I can also use a percussor machine to help me save my hands because releasing myofascial tissue is very difficult on the therapist. It's very hard to do. So I use a percussor occasionally to support some of the releases that I do with my hands. And the treatment takes about an hour, and most patients do make a note that the pain from the treatment, the discomfort of the treatment it can be intense at times, but after the treatment, they generally feel much better. Using the Ming Method, or this compilation of all these myofascial therapies that I promote, it usually takes about 3 to 6 sessions to resolve basically almost any type of injury. That's assuming you do the hydration program, some of the supplements that I recommend, which are the glucosamines, chondroitins, the MSMs, fish oils, these type of things, proteolytic enzymes. If you do these supplements, it will tend to speed up the healing process. So if you ever go to physical therapy and you're not satisfied with your results with traditional conventional physical therapy, consider giving the Ming Method a try, or doing deep myofascial work. To me is a great alternative. If you try that, I'm pretty sure that you will see very dramatic changes in a very short period of time. So for those who are willing to try, you can always contact me through my website at mingmethod.com, and you can actually come in for a hands-on treatment if you're not happy with the results of what you're getting currently. Also keep in mind that the video content in this video is not intended as a substitute for professional advice, treatment, or diagnosis. So what I recommend is you find yourself a competent manual therapist that has great hands, say a physical therapist or a massage therapist or an occupational therapist, a person that has really good hands that understands the whole concept of using myofascial release as a form of treatment. So give it a try. Let me know how it works. Subscribe if you like the content of this video, and hopefully if you have back pain, that you can resolve the back pain in a very relatively short period of time. So take a look at some myofascial therapy and let me know how it goes. Good luck.